Many healthcare workers often advocate for wage increases due to Japan's high cost of living. However, wage increases for healthcare workers essentially mean an increase in medical fees, which are health insurance premiums. I think this might be hard to accept in today's Japanese society, but do you think Alex is technically advanced, citing the example of the Japanese local government of Chinen? I think it's a problem with the Japanese system. For example, in the case of France during the COVID-19 crisis, the monthly salary of healthcare workers, they suddenly raised it to either 150 euros or 100 euros. In essence, from next month, the salaries of medical workers will go up by about 15,000 yen. And why is that possible? In France, most hospitals are state-owned, so the people who are working are kind of public servants. So if the government says they'll give them a raise, that's the end of it. In Japan, each hospital employs them. So they are employed by private hospitals. The hospital decides the staff's salary. So, medical security. For example, we got a lot of help from that medical professional, even if the person who did the health check says it should be 50,000 yen instead of the normal 100,000 yen. Probably the hospital will bite and it's over. So the hospital says they bought a big thing. They say they bought it. They won't pay it at the nursing home. So why did the salary of healthcare workers in France increase? Because healthcare workers work incredibly hard in the midst of Corona. In this Corona, we're saying we won't work. No, as expected. If you're really a healthcare worker, it's tough. So could you please stop the protest? I'll pay. That's the case, isn't it? But still, due to the strike, we need this person to work, right? So, it was decided to raise the salary. So, in the case of Japan too, we certainly don't work. We don't work. If you do it properly, you'll have to raise the salary, right? France, USA, South Korea, and I think Germany is the same, but in a system called industry-specific labor unions. In the automobile industry, it's an automobile, your company has an industrial association. But in the case of Japan, there are labor unions like Toyota, Matsuda, Nissan, and the automobile union. There are combinations for each company, aren't there? So when someone in a hospital in Japan says, let's go on strike, only the people of Trauman's hospital go on strike. When I said I was sick, they said I don't have to go to Toranomon Hospital. Ordinary people don't decide to increase the salary of the nurses at that hospital. They just don't have to go to that hospital, so they don't care. So it's not so good, right? We should be in solidarity in the industry, right? So when it becomes an industry-specific union, it's like the unions of hospitals all over Japan have to decide what month and day. That day is already, if we don't accept it, it's bad. If we can't accept it, even if patients come. So it's in the news all over Japan. So which will say, who should be the one to pay this low wage? The hospital should raise the wage properly, and we should have a union for each industry. So why did I phrase it like this? South Korea used to be a separate union of that company. When you do it in a company-specific union, even if you strike, it has no effect at all. So we changed the law and made it an industry-specific union. So as a result, South Korea also suddenly rises. And now I'm sure the minimum monthly wage is higher in South Korea than in Japan. Wasn't it higher in Japan? In that sense, we should make it an industry-specific union. But unfortunately, in Japan, Keidan-ren, where large corporations gather, is paying money. There's a group that pays money to the Liberal Democratic Party. So it's better to turn that Senate into a separate union, according to the law. There is nothing that the Liberal Democratic Party says. In essence, large companies like mobile companies can't make profits if they get striked by industry-specific unions. We donate lots of money to the Liberal Democratic Party as Keidan-ren, so we won't allow things like industry-specific unions to become stronger. Then when it comes to what such labor unions are doing, the union lady is somehow trying to get along with the Liberal Democratic Party. Even if you get along with the opposition, they don't have much power anymore. If I'm in the Liberal Democratic Party, I might have quite a bit of power. So for some reason, the Liberal Democratic Party, it turns out that the labor union is getting closer to the Liberal Democratic Party, and this is something that simply can't happen with industry unions. So originally, it should have been the Social Democratic Party or something like that. But now there's only Mizuho Fukushima in the Social Democratic Party. It's like a one-person party. So you'd think the Democratic Party, the Constitutional Democratic Party would do it, but rather than workers, it seems to be going in the direction of wanting to team up with the Communist Party, and the National Democratic Party is supposedly supported, but the National Democratic Party has a high deviation values, and if anything, there are many people in simple labor. We are not getting instructions from people. So there's no goal for the people around us. There's no party now that works for the happiness of ordinary workers. I'm thinking about where it could be.